Before starting an obstetric ultrasound, it's crucial to have everything ready and to make the patient feel at ease. First and foremost, we must always obtain informed consent. This means explaining the procedure to the patient in a way she understands and ensuring she agrees to it. We also need to understand her medical journey. Reviewing her medical history, any past pregnancies, and previous ultrasound results gives us a baseline for comparison. We ask about any current concerns, like bleeding or pain, as these can directly impact the scan. Knowing how far along the pregnancy is, also known as the gestational age, helps us choose the right tools and interpret the images correctly. Depending on the stage of pregnancy, the patient's bladder might need to be full or empty. A full bladder can help visualize the uterus better in early pregnancy. Later on, an empty bladder is more comfortable and provides clearer images. Finally, we make sure the patient is comfortable on the examination table, usually lying on her back. In later stages of pregnancy, we might tilt her slightly to the left to avoid pressure on a major vein. With the patient prepared, we can begin the ultrasound. Applying a generous amount of special gel to the patient's abdomen is essential. This gel helps the ultrasound waves travel from the probe to the body and back, creating the images. Choosing the right ultrasound probe is important for clear images. We consider the stage of pregnancy and what we need to see. Lower frequency probes are better for later stages or looking at structures deeper within the body. Higher frequency probes offer better detail for earlier pregnancies or examining structures closer to the surface. With the probe selected, we turn on the ultrasound machine. We usually start with a mode called 2D imaging, or B mode, which gives us black and white two-dimensional.
This video was proudly sponsored by One Browser. Don't miss out. One Browser is the must-have tool of 2024. Try it now. Thanks, gentlemen. Let's get back to our lovely video.
Dimensional images. The machine settings might need adjusting for brightness, contrast, and depth to optimize the images. The initial part of the scan focuses on the essentials, confirming the pregnancy's viability and determining gestational age. The very first thing we look for is the fetal heartbeat. This is a reassuring sign that the pregnancy is progressing as expected. We can measure the heart rate using M mode, which displays the heartbeat as a graph over time, or Doppler, which uses sound waves to detect movement and blood flow. Accurately estimating the gestational age is important for monitoring the baby's growth and planning for the birth. In the first trimester, we measure the crown rump length, which is the length of the embryo or fetus from the top of the head to the bottom of the torso. Later on, we use measurements like the biparietal diameter, the distance between the two parietal bones in the skull, head circumference, femur length, the length of the thigh bone, and abdominal circumference. Once we've checked the fetal heartbeat and estimated gestational age, we move on to a detailed examination. We assess the uterus, checking its size, shape, and position. We also look for any abnormalities like fibroids, which are benign tumors, or other masses. The placenta, the organ that nourishes the fetus, is examined next. We determine its location, making note of any unusual positioning, such as a low-lying placenta that might cover the cervix. We also look for any signs of placental abruption, where the placenta detaches from the uterine wall. Next, we focus on the fetus. We determine its position, whether it's head down, bottom down, or lying sideways. We also assess the amount of amniotic fluid, the fluid that surrounds and protects the baby. Too much fluid or too little fluid can indicate problems. Throughout the scan, we capture high-quality images of everything we see. These images become part of the patient's medical record and are crucial for future reference. After the scan, we gently wipe off the ultrasound gel and allow the patient to dress. We might share some initial findings, but emphasize that a full interpretation will come from a radiologist or the obstetrician.